My work involves quantitative analysis. We do a lot of costing of illness studies, so we look at the cost of certain particular illnesses, particularly in the areas of mental health. I also work in the area of long-term care, and in both of those areas we look at the costs of one intervention versus the other, also considering the outcomes of the intervention, so looking at cost effectiveness of interventions. And then also looking at studies where we look at the relationship between costs and service use and particular characteristics of individuals. We have a study that we've done recently with colleagues where we looked at people providing care to people with dementia and looked at the cost of the service use for them. We have an interesting new measure of dementia where we look at the dependence of the individual with dementia. And so we wanted to look at how sensitive that measure was to picking up differences in cost. That's cost in terms of the medical services that they use, in terms of the medication that they receive, in terms of social care receipt of services, and also in terms of some of the limited, some of the information on the informal care that they receive, so the unpaid care from family members and friends, we were able to cost as well in some instances. And we did find that the dependence score, as it's called, was very sensitive to the costs associated with people with dementia and the services that they use.